Welcome, Dr. Colino, to ScheinChats. Minimum touch orthodontics has a number of benefits. For patients, it means less pain and discomfort, shorter treatment times, and less appointments. For orthodontists, it means a more efficient and streamlined workflow. So let's discuss this. What is minimum touch orthodontics, and how is it different from traditional orthodontics?
Okay. Minimal touch orthodontics is a philosophy of working that try to minimize the total treatment timing and allows us to see our patients less times during the whole treatment. So for me, it has changed my daily work for sure. But if I have to tell you two advantages, the two best advantages are probably that. What is the difference between minimal touch orthodontics and conventional orthodontics? Normally, when we work in ortho, we have we are used to have all our appointments monthly. That creates an inefficient way of manage all the appointments of our patients. And that makes us to have more patients one normal day in our clinic, and sometimes it makes my team, for example, went out or go out late from the clinic. So if we try to become more efficient, if we try to minimize the time in chair and also the total treatment timing, we are going to improve probably the quality of life of our patients and the quality of life of our team.
Right, and in your expert opinion, what are the benefits of minimum touch orthodontics, not only for the orthodontist, but also for patients?
For my patients, they are very happy with this new philosophy of treatment because they can organize themselves. For example, they can't go to extra scholars activities in a very easy way because they don't have to wait too much time in office. Probably in less than 3 minutes, we have finished all our appointments. In the past, they have to wait probably 1 hour until until we went to treat them. For the orthodontist and for my team, for sure, it's an advantage because we have the possibility to see less patients one day, and we can organize better, and we can monitorize them during the week. And for that reason, we can work in a more efficient, more calm, and we can have everything under control.
Very interesting. And how exactly do you implement minimum touch orthodontics in your practice? And can you walk us through the typical workflow?
Okay, my typical day, for example, in clinic, is to have the first appointment with my patient and explain what is minimal touch orthodontics, what are we going to do, and how are we going to plan the whole treatment. Then, when they understand the concept, it's very easy to work with the patients. Why? Because they are going to employ short time in office, and they understand why. We monitorize them, and we organize the whole treatment from the beginning. From my team also is a good advantage because we can organize our teamwork, we can organize our schedule daily, and we can work in a better way, I would say.
Yeah, and then are there any other benefits that you see to the team because of this change?
Yes, I see more happy team, I can tell you. I can see that it's very easy to organize a clinic like us. Imagine that we have a high volume of patients, and when we try to change the way of work, if we try to dilate our appointments in 8 weeks, 10 weeks, we can see more patients daily, but we employ less times in them. So it's very easy to work with the system, it's very easy to planify everything, and it's very comfortable for my team because they can also have everything under control, which is important also for them.
Yeah, that sounds really great. And so what advice would you give orthodontists who are thinking about incorporating or switching to minimum touch orthodontics? Okay,
I have no doubts. I will change tomorrow if I haven't tested the minimal touch philosophy before. So I encourage them to try to change the way of understand orthodontics, to try to change the philosophy of treatment, and to try to think in the quality of life of their patients. If they try to diminish the total treatment timing and they only use things that are efficient for the patients, they will see that the expectations of their patients is going to be covered in a very easy and simple way.
Well, thank you so much, Dr. Colino. This has been great. And we're equally excited to see what the future holds for minimum touch orthodontics. And thanks again for joining us today at ScheinChat.
Thank you. Thank you very much.